Hey everyone, it's Kendra Duquette here with the Empowerment Hour, hosted by the Preventative Health Institute. So this is episode 2. I wanted to talk about what exactly is preventative health today, because we get that a lot. It's kind of a different, it's a new term that people aren't used to. And oftentimes people think that preventative health sounds like you're preventing health, but it's really not. It means you're living a lifestyle that prevents disease, okay? So we really believe 100% that this is the wave of the future. This is where, all medicine has to go. Right now, the healthcare system is really the sick care system. Conventional medicine is not equipped to deal with chronic conditions of any kind. They just aren't. They'll help you if if it's an emergency, you have a heart attack, they'll save your life. You have a car accident, they'll do what they have to do, surgery, save your life, whatever. But for chronic conditions, they don't know. They just don't know anything about it. So preventative health is so important. Unfortunately, most people are to a point where they're experiencing symptoms, so they actually have to, reverse that and get on their path to healing and then prevent anything else from coming up. Ideally, you want to get to a point where you're just simply living a lifestyle that prevents disease. Does that make sense? So no matter what it is, that's basically what it boils down to. But we have a few just kind of foundational pieces of what this means to us. So just a statistic, in case you don't know, if you're working with us already, of course you already know this, but if this is new to you, 95% of all chronic health conditions are diet, lifestyle, and environmental related. That's it. All chronic health conditions. Doesn't matter if it's autoimmune, cancer, just random chronic conditions. People are experiencing pain, brain fog. There's just so much going on right now with people. It's all comes down to diet, lifestyle, and environment. That's it. 5% is genetic. That 5%, you can be genetically predisposed to something, okay? But that can also be turned on or off like a light switch. So that's called epigenetics, with what you do with your diet, lifestyle, and environment, okay? So even if you are predisposed, it doesn't mean it's a life sentence for you, okay? As long as you're doing all of the right things, living this preventative health lifestyle, you can turn that off, okay? Also, just something to keep in mind, we hear a lot, and if you're going through the program and going to be working with people, you'll hear people say this all the time, or maybe you heard this yourself, maybe you say this yourself, but a lot of people will say, well, it runs in my family, or, I'm worried because my mother, died of breast cancer and my sister has it as well, or, oh, everybody in my family has diabetes, or we just have this. It runs in my family. Well, that's not true. It can be, like I said, 5% possibly genetic, but also mostly it is usually just the fact that people have lived the same lifestyles. They live in the same place, the same town. They've lived the same life. They've had the same stressors. They've eaten the same diet. Maybe they lived on a farm and had that, they were around the spray from the fields. Everybody's had this same lifestyle most of their lives. So that is why they tend to have the same conditions. Does that make sense? So anyway, I did get a little off there. Sorry. So a preventative health lifestyle simply means that we teach you everything that you need to do in your life, where you have control, where you're addressing everything with your diet that you need to do, all environmental factors that are within your control, your lifestyle. Your lifestyle can be, stressors in your life. Could be your partner, it could be your children, it could be your friends, it can be your job. Jobs are a huge one. There's so much that comes into your life, which means your lifestyle. Are you in your car for hours a day? Are you, running, living the super busy lifestyle? All of these things play into causing disease or preventing disease. Does that make sense? So that's where our focus goes. Also, we talk about living under the precautionary principle. So if you've never heard what that is, the way, it's not just, I was going to say America, but it's really the world, the way the world lives now is, things are proven, or they're safe. People assume they're safe. The FDA says it's safe or whatever, until proven guilty. So, just an example would be something like cigarettes. They're fine until it was proven that they caused cancer, or asbestos was fine until it was proven to cause cancer. Well, I can't talk today. Precautionary principle is that you assume that these are not healthy for us until they've been proven that they are. Okay, so we are really under not living by the precautionary principle at the moment, with all of this narrative going on. This is the start of 2022, and pushing the shot and all of that kind of thing, that is still in an experimental phase, and people are just getting it without even thinking about the fact that there's no proof that it even works. So we take a different approach, exact opposite. And you can also think of it as it's preventative health is just basically the opposite of conventional medicine. So conventional medicine, they're looking to name, first of all, your set of symptoms. So you go in with, you're experiencing all these symptoms. They're going to want to run tests, a million different tests until they can name something, give you a label, and then they will either prescribe medication or surgery. So medication is simply a Band-Aid fix, to make you feel like you're better, or surgery, of course, just cut it out and then you'll feel better is the idea. So a preventative health approach is the exact opposite of that. We're looking at root cause. Why are you experiencing these symptoms? And that can go pretty deep, like I said, but the why, and then fix that, and then the symptoms go away, and then you continue on this path to health and healing the rest of your life, so that you're not experiencing symptoms. So hopefully my ramblings have helped explain what a preventative health is, and living a preventative health lifestyle. So that's what we teach in our programs. If you are just going through the program to work on your own health and healing, to be a personal preventative health practitioner, or if you're actually taking this to the next level and going to work with patients and teach them how to live this lifestyle and really change their life. Either way, that's at the foundation of our program. The principle is preventative health, a preventative health lifestyle. Okay, so hopefully this helped. I'm going to try to answer in each of these videos, questions that we often get, just kind of breaking them down and making it a little more simple for you. So hopefully that gave you some information, and we'll see you in the next one. Bye.